Volker, it's great to have you here at the daily recap session of the WFN. Today is the last day of the Congress.
Yeah.
And I had the chance today to visit a wonderful session together with the WFNR, which you had chaired. Do you want to give a short overview?
Yeah, okay. We are very glad that we had a chance to participate on the World Congress of Neurology with elements of rehabilitation. We have done that before. We did it in Marrakesh and in Kyoto years ago. But I think over the last couple of months, the cooperation between the World Federation of Neuro Rehab and the World Federation of Neurology has very, very much shown that there is added value. We did a lot of things together, Brain Awareness Week and Brain Day and all of this. And coming back to the session, I think the major impact on it is that we wanted to give a review on the state of affairs of neurological rehabilitation in various countries and various continents. And the bottom line, cut a long story short, is that we have a definite tremendous gap between what is needed and what is available. That means we have paucity of personnel, we have shortcuttings in money, we have shortcuttings in instrumentation and all of this. And the only way to solve that will be that we have to think about using other ways of bringing rehabilitation to the patient. We will not be able, for hundreds of millions of people in the world, for hundreds of millions, we will not be able to do it in the classical form as we used to do it in very well-developed countries. So we have to think about alternative routes. And if there was anything good we have learned from the COVID-19 pandemic, then it was that our ease in dealing with digital communication techniques has very much improved. And therefore, I think that digital ways of teaching, of education, of rolling out, let's say, strategies and skills of rehabilitation to the general public, to caregivers, to families and to patients will be very effective in the future. Especially considering that the availability of internet and devices at smartphones and tablets is very good. The cost, for instance, for telecommunication in India is not even 5% of the cost in Germany or England or the United States. Therefore, it's an inexpensive way to use these channels, these methods. What we are doing at the moment are basically three things. One is that we roll out at 8 different places in different continents, primarily in low-middle-income countries, concepts of community-based rehabilitation or family-based rehabilitation. That means that the rehabilitation is not provided at a hospital, but after some counseling is provided either by the relatives of the patient or by people in the community. This is especially important for rural areas, as one can consider, and 80% in these big countries as China or India, 80% of people live in rural areas. Number 2 is we are at the moment developing a complete digital representation of a rehabilitation hospital, inpatient or outpatient, with all sorts of therapists in there, physicians, therapists, counselors. This is run through an artificial intelligence. So you can go in there and you can get all sorts of information. You can have a look at skills, at let's say, training techniques in physiotherapy or occupational therapy or speech pathology. And this is in a very, let's say, in the form of a dialogue. So the patient or the caregiver or someone, whoever, can go in there and ask questions. And we use a ChatGPT-like language AI, and we can put all relevant information, what is the best evidence-based therapy for a particular neurological problem, for instance, and the AI will answer this. This is easily adaptable to multiple languages, and it's certainly a good tool. We hope that by the end of the year or so, we will have a fairly good primary prototype of this, which we can use for rolling out this type of information on a worldwide level. And the third point is, when we look at all the activities we jointly do with World Federation of Neurology, as the intersectoral global action plan that WHO has initiated, my impression is that there are a lot of claims made, okay, and they are done in a very complex way. And what we should do, however, is make things on the first step, at least make things simple and applicable. So what we will do as the third element for what WFNR is now looking at is to define sort of a blueprint for simple claims on what should be done in terms of neurorehabilitation, especially in low middle income countries, which should be done immediately and easy and sufficient. That is the third element we are thinking of.
Wonderful. Had there been any session, now it's the last day of the Congress, so had there been any session which especially caught your attention, lessons learned?
I think what was most impressive for me, and I think that was Walter Grisol's nucleus of idea, to look at advocacy problems. And advocacy problems are extremely important. On the other hand, my impression is more and more that we are physicians, we're therapists, scientists, whatever we are, but we are not media people, and we have not the sufficient skills. And when you want to go to an advocacy at a level to influence politician decision makers, opinion makers, whoever, then you have to do it in a much more, let's say, elaborate way. And I think what we need in future is also a cooperation with media managers to do something like this. Yeah. I know WFN is starting that. We do the same. It's always, of course, a limitation of financial resources as well.
So, are you coming to Seoul as well, to Korea?
I will, whenever possible, I will certainly do that, and we will keep this biannual interaction. We will have a WFN session on our next World Congress, which is in May 14th, so in May next year in Vancouver. And we will have a joint session again, and then we do it more or less annually, as we have biannual meetings, both organizations, and so we with changing years, so it's not a problem that we at least have a platform for discussion year by year.
Thank you. So thank you.
My pleasure.
Yes, thank you, and please stay tuned also on our website. You will get some info also on this very interesting artificial intelligence project. And of course, we're looking forward to seeing you all in Korea, but eventually also at the WFNR.
I hope in Vancouver.
Okay, super.
In May next year. Thank you.